Well, welcome back. You know, nothing prepares a parent for a life-changing diagnosis on their child, and that was the experience for one local family as their son was diagnosed with type 1 diabetes at just the age of 2. But with the help of UT Physicians team, now 8-year-old Ethan is happy and also a very healthy boy. Here with more is UT Physicians pediatric endocrinologist Dr. Michael Yafi, along with Ethan's parents, Nolan and Victoria. A big welcome to all of you. Welcome to the show.
Thank you.
Thank you.
And of course, this is National Diabetes Awareness Month. And Dr. Yafi, I'd like to talk with you. First of all, how common is pediatric diabetes?
Well, it's probably 1 in 600. So it's getting to be one of the most common chronic illnesses in the field of pediatrics.
And is this something that is genetically predisposed, or really can this happen to any child?
Well, it's an autoimmune disease, so it can happen to anyone. But if you have a strong family history, then yes, what you are saying is correct. It's genetically predisposed. So there is a big genetic influence, but in reality, any child can get type 1 diabetes.
And before we dive more into Ethan's story, doctor, if you can talk about when a patient's blood sugar gets too high or even too low. I mean, so many things can get into serious levels here.
Absolutely. I mean, the normal blood sugar, if fasting should be around 126 milligrams per deciliter. When it gets higher than that as fasting, then the diagnosis of diabetes is confirmed when associated with elevated hemoglobin A1C, and of course symptoms of diabetes, polydipsia and polyuria, increased thirst and urination. So with that, you can also get the autoimmune markers for type 1 diabetes to make a final confirmation, and voila, you have type 1 diabetes. So diabetes is the increased blood sugar. Type 1 diabetes happens mostly in children, young children, while type 2 happens either in obese kids or in older population. But in general, type 1 is the autoimmune diabetes for young children.
And let's bring in parents, Victoria and Nolan, to talk about Ethan. And as we know, Ethan is a strong, healthy boy right now. But I can imagine, Mom and Dad, when that diagnosis first happened, it was probably very scary for both of you.
It was.
And how
Yes.
how did you manage this? Because I know Ethan's been checking his own blood sugar for about 4 years now. So it's just part of life, but it's something that he had to really grow up to do.
That's right. And we worked with UT for many years. Thankfully, with Dr. Yafi as a very close friend for us, just showed us the best ways to test his sugar, where the ranges to keep it, helped us with everything along the way.
Adjusting to the new normal, as Ethan knows it now today. So, Ethan, we see this video of you. This is you checking your blood sugar. Talk to us about this, because it's your part of life, but it's just something you have to do every day. Everything seems to be pretty good, right?
Yeah.
Sounds easy enough, for sure. Doctor, if parents have a newly diagnosed child, or they might feel like they are isolated and alone, but this is something that they can tackle and it is part of life, they just really need to take the time and understand this is the new normal.
Absolutely. I think the most important aspect is having vigilant parents. I think Ethan was extremely lucky to have wonderful parents who were able to detect diabetes symptoms very early on, and then help me to make the diagnosis. And then after that, it's a learning process. You know, the child and the family have to learn the concept of carbohydrate counting, how to test blood sugar on a daily basis, what to do when the blood sugar is elevated or low, and so on. So it's a continuous learning, life learning process.
Absolutely. Well, it looks like the BMX skills are pretty awesome, Ethan, in that picture there. Nolan, Victoria, Ethan, and Dr. Yafi, thank you all so much for your time today, and continued health, Ethan.
Thank you.
Thank you.
If you would like more information or to schedule a consultation, you can visit utphysicians.com or call 888-488-3627. Well, coming up next.